A. Maintain humidified oxygen via nasal cannula. B. Position client laterally with the neck extended. C. Assess for hypoventilation by auscultating the lungs. D. Remove the airway only when client is fully conscious. Correct answer. Positioning the client laterally with the neck extended does not obstruct the airway so that drainage of secretions and oxygen and carbon dioxide exchange can occur. John suddenly experiences a seizure, and Nurse Gina notices that John exhibits uncontrollable jerking movements. Nurse Gina documents that John experienced which type of seizure? A. Absence seizure. B. Tonic seizure. C. Clonic seizure. D. Myoclonic seizure. Correct answer. Myoclonic seizure is characterized by sudden uncontrollable jerking movements of a single or multiple muscle group. Nurse Rachel teaches a client who has been recently diagnosed with hepatitis A about untoward signs and symptoms related to hepatitis that may develop. The one that should be reported immediately to the physician is A. Yellow urine. B. Clay-colored stools. C. Nausea. D. Restlessness. Correct answer. Clay-colored stools are indicative of hepatic obstruction. Nurse Lily has been assigned to a client with Raynaud and RS-QuoS disease. Nurse Lily realizes that the etiology of the disease is unknown, but it is characterized by A. Episodic vasospastic disorder of the aorta. B. Episodic vasospastic disorder of small veins. C. Episodic vasospastic disorder of capillaries. D. Episodic vasospastic disorder of the small arteries. Correct answer. Raynaud's disease is characterized by vasospasms of the small cutaneous arteries that involves fingers and toes. Ryan has undergone subtotal gastrectomy. The nurse should expect that nasogastric tube drainage will be wet color for about 12 to 24 hours after surgery. A. Dark brown. Correct answer. 12 to 24 hours after subtotal gastrectomy, gastric drainage is normally brown, which indicates digested food. Myrna, a 52-year-old client with a fractured left tibia, has a long leg cast and she is using crutches to ambulate. Nurse Joy assesses for which sign and symptom that indicates complication associated with crutch walking. A. Weak biceps brachii. B. Forearm weakness. C. Triceps muscle spasm. D. Left leg discomfort. Correct answer. Forearm muscle weakness is a probable sign of radial nerve injury caused by crutch pressure on the axilla. Nurse Liza is assigned to care for a client who has returned to the nursing unit after left nephrectomy. Nurse Liza and RS-QuoS highest priority would be in HELIP. A. Able to turn side to side. B. Temperature. C. Hourly urine output. D. Able to sip. Correct answer. After nephrectomy, it is necessary to measure urine output hourly. This is done to assess the effectiveness of the remaining kidney, also to detect renal failure early. During the first several hours after a cardiac catheterization, it would be most essential for Nurse Cherry to inhale. A. Elevate client's bed at 45 and deg. B. Monitor client's temperature every hour. C. Instruct the client to cough and deep breathe every 2 hours. D. Correct answer. Blood pressure is monitored to detect hypotension, which may indicate shock or hemorrhage. Apical pulse is taken to detect dysrhythmias related to cardiac irritability. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? A. Correct answer. Liver inflammation and obstruction block the normal flow of bile. Excess bilirubin turns the skin and sclera yellow and the urine dark and frothy. Patrick, who is hospitalized following a myocardial infarction, asks the nurse why he is taking morphine. The nurse Correct answer. Morphine is a central nervous system depressant used to relieve the pain associated with myocardial infarction. It also decreases apprehension and prevents cardiogenic shock. Which of the following antituberculosis drugs can damage the 8th cranial nerve? A. Ethambutol hydrochloride myambut. Correct answer. Streptomycin is an aminoglycoside, and damage on the 8th cranial nerve, ototoxicity, is a common side effect of aminoglycosides. Which of the following compilations should the nurse carefully monitors a client with acute pancreatitis? Correct answer. A client with acute pancreatitis is prone to complications associated with respiratory system. Kate, who has undergone mitral valve replacement, suddenly experiences continuous bleeding from the surgical incision during postoperative period. Which of the following pharmaceutical agents should Nurse Asa prepare to administer to Kate? Correct answer. Protamine sulfate is used to prevent continuous bleeding in client who has undergone open heart surgery. A newly admitted client is diagnosed with Hodgkin and RS-QuoS disease undergoes an excisional cervical. Correct answer. Assessing for an open airway is the priority. The procedure involves the neck, the anesthesia may have affected the swallowing reflex or the inflammation may have closed in on the airway leading to ineffective air exchange. Mrs. Chua, a 78-year-old client, is admitted with the diagnosis of mild chronic heart failure. The nurse expects to hear when listening to client and RS-QuoS lungs indicative of chronic heart failure would be. Correct answer. Left-sided heart failure causes fluid accumulation in the capillary network of the lung. Fluid eventually enters alveolar spaces and causes crackling sounds at the end of inspiration. Nurse Donna is aware that the shift of body fluids associated with intravenous administration of albumin occurs in the process of a. Filtration. B. Osmosis. Correct answer. Osmosis is the movement of fluid from an area of lesser solute concentration to an area of greater solute concentration. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? A. Improve respiratory status. Correct answer. The primary goal of therapy for the client with pulmonary edema or heart failure is increasing cardiac output. Pulmonary edema is an acute medical emergency requiring immediate intervention. What would be the primary goal of therapy for a client with pulmonary edema and heart failure? A. Increase cardiac output. B. Peripheral edema decreased. C. Correct answer. Pancreatitis is the inflammation of the pancreas that is characterized by recurring or persistent abdominal pain with or without stearia. A nurse is providing dietary information to a client with pancreatitis. All of the following foods should be avoided by the client, except. Correct answer. Addison and Hashimoto's disease is an endocrine disorder that develops when the adrenal glands are not able to produce enough cortisol. A client with Addison and Hashimoto's disease is receiving fludrocortisone acetate. The nurse knows that the therapeutic effect of this is to. No. Correct answer.